Alprostadil. Alprostadil injection and suppositories are used to treat certain type of erectile dysfunction in men. Alprostadil injection is also sometimes used in combination with other treatments to diagnose erectile dysfunction. Alprostadil is in a class of medications called vasodilators. It works by relaxing the muscles and blood vessels in the penis to keep enough body in the penis so that an erection can occur. Alprostadil does not cure erectile dysfunction or increase sexual desire. Alprostadil does not prevent pregnancy or the spread of sexual transmitted disease such as human immunodeficiency virus (HIV). How should this medication be used? Alprostadil comes as a powder to be mixed with the liquid provide in the package and inject into the penis as a urethral suppositories. Alprostadil is used as needle before sexual activity. An erection may occur within 5 to 20 minutes after using the erection and within 5 to 10 minutes after using the pellet. The erection should last approximately 30 to 60 minutes. Alprostadil injection should not be used more than 3 times per week, with at least 24 hours between uses. Alprostadil pellet should not be used more than twice in a 24 hours period. Follow the direction on your prescription label carefully and ask your doctor or pharmacist to explain to any part you do not understand. Use alprostadil extracts as directed. Do not use more or less of it or use it more often than prescribed by your doctor. Your doctor will administer the first dose of alprostadil in his or her office to determine the proper dose for you. After you begin to use alprostadil at home, your doctor may gradually increase or decrease your dose. Tell your doctor if you do not experience satisfactory erection or if your erections last for too long. But do not change your dose without taking to your doctor. You must be trained by your doctor before using alprostadil at home. Be sure that you understand exactly how to use alprostadil. Ask your doctor or pharmacist if you have any question about how to use your medication. Do not reuse needles, syringes, cartridge, vials, pellet, or applicators. Dispose of used needle and syringes in a puncture-resistant container. Ask to your doctor or pharmacist how to dispose of the container. Ask your pharmacist or doctor for a copy of the manufacturer's information for the patient. Other uses for this medication. This medication may be prescribed by the other risk. Ask your doctor or pharmacist for more information. Before using alprostadil, tell your doctor and pharmacist if you are allergic to alprostadil, other prostaglandin medications such as misoprostol, cytotec, in arthrotec, bimatroprost, lumigan, latanoprost, Saratan, and Travatan, or any other medications. Tell your doctor and pharmacist what other prescription and non-prescription medication, vitamins, nutritional supplement, and herbal product you are taking or plan to take. Be sure to mention any of the following anticoagulant blood thinner, such as heparin and warfarin, coumadin, appetite suppressant medication for allergic cold, high blood pressure, or sinus problem, and any other treatment for erectile dysfunctions. Your doctor may need to change the dose of your medication or monitor you carefully for side effects. Tell your doctor if you have ever been advised by a healthcare professional to avoid sexual activity for medical reasons, and if you have ever had blood cell problems such as sickle cell anemia, leukemia, cancer of the white blood cell, multiple myeloma, cancer of the plasma cell, thrombobacteremia, condition in which too many platelets are produced, or polycythemia, condition in which too many red blood cells are produced, condition affecting the shape of the penis, angulation, cavernosal fibrosis, or Freenosy disease. A penile implant device that is surgical placed inside the penis to treat erectile dysfunction or heart failure. Also tell your doctor if you or any of your family members has ever had a blood clot in the legs or lungs, and if you have recently undergone major surgery. Your doctor may tell you not to use alprostadil. If you are using the Alprostadil pellet, tell your doctor if you have ever had any narrowing, scarring, or swelling of the urinary opening of the penis or the top tip of the penis. Your doctor will probably tell you not to be Alprostadil pellet. Tell your doctor if you have ever had a bleeding disorder, a history of fainting, or kidney, liver, or lung disease. Tell your doctor if your partner is pregnant or plans to become pregnant. Do not use alprostadil pellet before sexual activity with a pregnant woman or a woman who may become pregnant without using the condom barrier. You should not that alprostadil may cause dizziness, lightheadedness, and fainting. Do not drive a car or operate machinery after using alprostadil until you know how this medication affects you. Talk to your doctor about the use of alcohol during treatment with alprostadil. Alcohol may decrease the effectiveness of this medication. You should know that a small amount of bleeding may occur in the area where the medication was given. This can increase the risk of transmitting blood-borne disease, conditions that are spread throughout contaminated blood, such as HIV, hepatitis B, and hepatitis C, between you and your partner. Tell your doctor if you or your partner has a blood-borne disease. What special dietary instructions should I follow? Unless your doctor tells you otherwise, continue your normal diet. What side effect can this medication cause? Bleeding or bruising in the place where you administration the medication. Pain or itching in the penis, testicle, legs, or perineum. Warmth or burning sensation in the urinary opening of the penis. Redness of the penis. Headache, back pain, skin problem, vision problem. Some side effect can be serious. If you experience any of the symptoms, call your doctor immediately. Erection lasting more than 4 hours. Redness, swelling, tenderness, or unusual craving of the erected penis. Nodules or hard areas on the penis. Fast heartbeat, fainting, swollen veins in the leg. If you experience a serious side effect, you or your doctor may send a report of the food or drug administered. What should I know about storage and disposal of the medication? Keep this medication in the container it came in, tightly closed and out of reach of children. Store alprostadil vials and cartridge at room temperature and away from excess heat and the moisture. Read the manufacturer's instruction for information about how long alprostadil solution may be stored after mixing and where it should be kept. Alprostadil pellets should not be stored in the original package in the refrigerator, but may be kept at room temperature for up to all 14 days before use. Do not expose the medication to higher temperature or place it in direct sunlight since this will make it ineffective. It is important to keep all medication out of sight and reach of children as many containers, such as weekly pill millers and those for eye drops, cream, patches, and inhalers, are not child resistant and young children can open them easily. To protect your children from poisonery, always lock safety caps and immediately place the medication in a safe location, one that is up and away and out of their sight and reach. When traveling, do not store alprostadil in checked luggage or leave it in the car where it may be exposed to extreme temperature. Store alprostadil pellet in a portable ice pack or cooler. Unneeded medication should be disposed of a special way to ensure that pets, children, and other people cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to dispose of your medication is through the medical take back program. Talk to a pharmacist or contact your local garbage recycling department to learn about take back program in your community. In case of emergency overdose, if someone uses too much alprostadil, call your local poison control center. Symptoms of overdose may include fainting, dizziness, blurred vision, nausea, pain in the penis that does not away, erection lasting longer than 6 hours. What other information should I know? Keep all appointments with your doctor. It is important to have regular follow-up visit with your doctor every 3 months. Do not let anyone else use your medication needles or syringes. Ask your pharmacist any question you have about refilling your prescription. It is important for you to keep a list of all the prescription and non-prescription medication you are talking, as well as any product such as vitamins, minerals, or other dietary supplement. You should be in this list with you each time you visit a doctor or if you are admitted to a hospital. It is also important information to carry with you in the case of emergencies. Other names: prostaglandin.